And Assalamualaikum. My name is Nia Rashadah binti Azhar, D20A0066, and in this presentation, I will share about Francisellosis. So, what causes Francisellosis? The causative agent of this disease is Francisella novatensis, which is a gram-negative facultative intracellular bacterium, and it is then divided into two subspecies. First is Francisella novatensis subspecies novatensis, which usually affects marine fish species such as Atlantic cod. And the second subspecies is Francesella novatensis subspecies orientalis, primarily affects freshwater and brackish water species such as tilapia. And this disease transmitted by horizontal or can be as waterborne. The clinical signs that can be seen are pale body, white spots or white nodules on spleen, kidney and also gills, as can be seen in this picture, on A showing white nodules on spleen and on B showing white nodules on gills. And we can also see splenomegaly and also hepatomegaly, and the fish that is infested by this bacteria will be loss of appetite. Moving on to diagnostic workup, firstly would be cross-examination, where we can see granulomas or white nodules on the kidney, spleen and also gills, as I explained earlier in the clinical sign. And secondly would be microscopy examination, where we can send that organ for histopathology and we can see granuloma with central necrosis and bacteria presence in the organ. As can be seen in this picture, there is typical granuloma composed of macrophage with large vacuoles and intracellular bacteria inside it. And we can also see early degenerative change in a splenic granuloma. Thirdly would be microbiological methods, where we can culture this organ on specialized agar, where we can use cysteine, hard agar with blood, because apparently this bacteria requires cysteine for growth. And then we can also send the samples for PCR and ELISA. So for geographical distribution, as you can see in this world map by Nguyen 2015, the black dot showing the distribution of FNO, while the red dot showing distribution of FNN. As we can see, FNO is more common, which have worldwide distribution and present in different regions, example in Southeast Asian, China, Japan and also Europe, while the FNN only can be seen in this area over here. Next is the risk factors. Firstly will be environmental factors, which include water quality issues and also water temperature, because apparently FNO thrive in warmer waters, meanwhile FNN prefers colder water. Second will be host-related factors such as weakened immune system, which can be caused by stress, nutrition or concurrent infections such as parasitic or viral diseases. And developmental factors or stages also can be one of the factors where juvenile fish are more susceptible due to their immature immune system. And lastly will be aquaculture practices such as overcrowding and also poor hygiene and biosecurity. Lastly will be treatment and prevention. We can use fluorophenical as a medicated feed with dosage of 15 mg per kg for 10 days, or we can also use oxytetracycline with immersion bath 200 to 700 ppm per 6 hours, or it can also be used in feed with dosage of 2.5 to 3.5 gram per 100 gram of feed SID for 10 days. We can also give supportive therapy to help in treat this fish by improving water quality and also reduce stress. And to prevent this disease, we can do quarantine of new fish and not mix the stocks, as new fish can bring this disease to the other fishes. So that's all from me. Thank you.